I'm Dr. Michelle, and today I want to have a conversation that many people avoid, but almost everyone wonders about at some point in their lives. I work in men's health, and over the years I've sat across from men in their 50s, 60s, 70s, and even 80s, who all share a quiet concern. Is this it? Is intimacy just something that fades away with age? Let me start by saying this clearly. Intimacy does not have an expiration date. Connection does not retire. Your body changes over time, yes, but change is not the same thing as loss. What often disappears is not ability, but confidence. And confidence is something we can rebuild with knowledge, communication, and a healthier mindset. One of the biggest misunderstandings I see is the belief that any difficulty in the bedroom must simply be because I'm older. While aging does affect hormones, circulation, and tissue elasticity, it is rarely the sole cause of intimacy concerns. Lifestyle habits, cardiovascular health, stress levels, medications, hydration, emotional distance, and unspoken fears all play powerful roles. Sexual health is not separate from overall health. It is deeply connected to your heart, your brain, your hormones, and your relationship. When you improve one area, you often improve the others. That's empowering, because it means you're not helpless. There are changes you can make starting now. Let's talk about something that feels taboo for many men: natural body fluids during intimacy. A surprising number of men carry the idea that these fluids are somehow dirty or unpleasant. That belief often comes from cultural messaging, not biology. From a medical perspective, these fluids exist for a reason. They help reduce friction, protect delicate tissues, maintain a healthy balance of microorganisms, and signal readiness and comfort. They are primarily composed of water, electrolytes, proteins, and protective compounds. In other words, they are a normal, healthy part of the body's design. When a man reacts with disgust or avoidance, even subtly, it can create emotional distance. His partner may interpret that reaction as rejection. What was meant to be a moment of closeness becomes a moment of insecurity. Shifting your mindset from "this is messy" to "this is natural and healthy" can change the emotional tone of intimacy almost instantly. Another common concern men bring up quietly is taste or smell. Here's the truth: variation is normal. Just as your own sweat, breath, or natural scent changes based on diet, hydration, stress, and hormones, so does your partner's. Hydration tends to produce a milder scent. Certain foods like garlic, onions, strong spices, alcohol, and coffee can alter body chemistry temporarily. Hormonal cycles and life stages, including menopause, influence the amount and consistency of natural lubrication. These changes are not flaws. They are biology in motion. However, if there is a sudden, strong, unpleasant odor accompanied by itching, burning, pain, or discharge that looks unusual, that can indicate a treatable imbalance or infection. The key difference is this: normal variation versus symptomatic change. One calls for understanding, the other calls for medical attention. What doesn't help is criticism or silent judgment. What does help is curiosity and kindness. Safety is another topic that deserves clarity. Many couples assume that if there are no visible symptoms, there is no risk of infection. Unfortunately, that is not always true. Some sexually transmitted infections can be present without obvious signs, and they can be transmitted through oral contact as well as intercourse. This does not mean intimacy should be feared. It means it should be approached responsibly. Honest conversations about sexual history, mutual testing, and regular health checkups are not signs of mistrust. They are signs of partnership. For new relationships especially, testing before becoming sexually active is one of the most respectful things you can do for each other. In long-term relationships, periodic screening can provide peace of mind. Safety does not diminish romance. It builds the foundation for deeper trust. Silence is often the real barrier. I have seen couples drift apart not because of disease or dysfunction, but because neither person felt comfortable speaking up. A man may notice a change and worry about offending his partner. A woman may sense hesitation and assume she is no longer desired. Without communication, both partners create their own explanations, and those explanations are usually harsher than reality. Bodies change with time. After menopause, for example, natural lubrication may decrease, and tissues can become thinner or more sensitive. That doesn't mean intimacy is over. It means adjustments may be helpful. Lubricants, longer foreplay, hormonal treatments prescribed by a physician, or simple pacing changes can make a significant difference. But none of those solutions happen if no one speaks up. Communication is not awkward when it is framed as teamwork. Instead of saying, "Something's wrong," try, "How are you feeling lately?" Or, "Is there anything that would make this more comfortable for you?" That small shift changes the energy entirely. At the core of everything is acceptance. Acceptance is more powerful than technique. When a partner feels fully accepted, body, scent, sounds, vulnerability and all, the nervous system relaxes. And when the nervous system relaxes, arousal becomes easier. Stress is one of the biggest inhibitors of sexual response. If someone feels judged or self-conscious, their body shifts into a subtle stress response, making lubrication and arousal more difficult. On the other hand, when someone feels safe, the body produces hormones that support bonding and pleasure. Acceptance communicates, "You are safe with me." That message can heal insecurities that have been carried for years. It's also important to address men directly about their own bodies. Erectile changes, for example, are common with age, but they are not always permanent or untreatable. Blood vessel health is crucial for erections, which means cardiovascular fitness matters. Regular exercise improves circulation. Managing blood pressure, cholesterol, and blood sugar protects vascular health. Getting adequate sleep supports testosterone production. Reducing alcohol intake can improve performance. Chronic stress elevates cortisol, which interferes with sexual function. In many cases, improving general health improves sexual health. When medication is needed, there are safe and effective options, but they work best when combined with healthy habits. Emotional intimacy also plays a larger role than many men realize. Physical desire is influenced by how connected you feel outside the bedroom. Small gestures of affection, shared laughter, and meaningful conversation strengthen emotional bonds, which then enhance physical closeness. If your relationship has tension, unresolved conflict, or emotional distance, addressing those issues can revive intimacy more effectively than any pill. Sometimes couples counseling or sex therapy provides a safe space to discuss concerns that feel difficult to raise alone. Seeking help is not a sign of weakness. It is a sign of investment in your relationship. Let's talk about aging honestly. Your body at 70 is not your body at 25, but maturity brings advantages too. Many couples report that intimacy becomes less about performance and more about connection over time. There is less pressure to impress and more space to explore. Slower pacing can actually enhance sensation and emotional depth. Experience brings patience, and patience can be incredibly attractive. Instead of focusing on what has changed, focus on what has evolved. Intimacy can become more playful, more communicative, and more satisfying when you release unrealistic comparisons to youth. If you want practical steps, start simple. Have a health conversation with your partner outside of a sexual setting. Discuss testing, comfort levels, and any recent changes in your bodies. Stay hydrated and maintain balanced nutrition. Prioritize cardiovascular exercise at least 3 to 4 times per week. Limit smoking and excessive alcohol use. Address chronic conditions with your physician rather than ignoring them. During intimacy, approach differences with curiosity rather than criticism. And most importantly, express appreciation. A simple, "I love being close to you," goes a long way. I also want to normalize that feeling shy about these topics is completely human. Most men were never taught how to talk openly about intimacy. Many grew up in environments where vulnerability was discouraged. But vulnerability is not weakness. It is the doorway to deeper connection. When you allow yourself to ask questions, to learn, and to grow, you model emotional strength. And when your partner sees that openness, she is more likely to open up too. Passion does not disappear with age, it transforms. It becomes less about urgency and more about presence, less about proving something and more about sharing something. If you let go of shame, invest in your health, and communicate with respect, your later decades can be some of the most connected years of your life. You do not need gimmicks, miracle supplements, or secret tricks. You need knowledge, honesty, and care. So if you take one message from this conversation, let it be this: your body is not your enemy, and neither is your partner's. Intimacy thrives where there is safety, curiosity, and acceptance. When you approach connection with compassion instead of criticism, you create an environment where both of you can relax, explore, and enjoy each other fully. Age does not disqualify you from passion. Silence does. Replace silence with conversation. Replace judgment with understanding. And replace fear with informed confidence. Your relationship and your health will thank you for it.